Welcome once again to the Family Connections Adapt Coalition YouTube Watch Party series. This time we are talking about managing stress, mental health, and self care during the pandemic with Kathleen Pete from Family Connections Outpatient Mental Health and Substance Abuse Services Program. I thank you, Kathleen, for being here with us today. We truly appreciate it, and we're excited to learn about this topic. We know that individuals have been very stressed out over this time. They've been trying to find ways to support not just their own mental health, but the mental health of their either consumers or their family members or friends, and trying to find new ways to take care of themselves, to take care of their wellness in various ways and various techniques, which is some things that we've heard from our membership. So before we begin, I just want to say welcome, Kathleen. Thank you so much for being here with us.
Thank you so much, Joel, for having me. And thank you for everyone that's tuning in. I really appreciate this opportunity to be able to kind of share some knowledge about kind of managing stress, mental health, and self care during this really unique time. With managing the pandemic and everything that's kind of happening around us in the world today.
Just real quick before we move on to the full discussion, for those who do not know about Adapt and our coalition, just give you a very brief synopsis. We are a coalition, which basically means we're a group of volunteers. Except for our staff, we're a group of volunteers who work on preventing and reducing underage drinking and substance use disorder throughout Essex County. We do that by empowering our members, our youth leaders, our community members, our collaborative partners to not just educate and raise awareness, but also to modify policies and programs that can help change behavior and thought processes over time regarding the use of substances. And as we're having this conversation today regarding mental health, it's important for us to have a discussion about these topics because we want to make sure that individuals understand sometimes folks use these substances or young individuals drink because they don't know how to deal with stress. They don't know how to manage their mental health. They don't know how to cope with what's going on. So they turn to substances to kind of shield themselves from that pain that they're dealing with or from the challenges that they're dealing with. So these conversations with Kathleen, the conversations we had the last time on our watch party with Danye, and conversations we're going to continue to have with our coalition members and partners are very important because they can build up awareness and also build up the need for changing of policies and programs to support our residents here. Uh, we have a structure where we work in a committees, in various committees to reduce the substance use and misuse that we have here in the county and to make sure that we work with partners to change the policies and programs. We are managed by Family Connections and funded through the New Jersey Division of Mental Health and Addiction Services and the Office of National Drug Control Policy at the federal level. If you do not know about Family Connections, we've been around since 1879, and that's not a typo. Yes, 1879, looking to support the well being of individuals in Essex County and beyond. Here at Adapt, our focus, as I stated, underage drinking, prescription drug abuse and misuse, and tobacco use, vaping by minors. We're looking to decrease access to these substances, but also change policies and practices. And we follow 7 strategies for community change by the Communities Anti Drug Coalitions of America, which start with providing information and raising awareness, all the way down to that modifying and changing policy piece. A couple other things. We have 4 committees right now, so we hope that as you learn more about ADAPT, you can become more involved with the work that we're doing. We have the Underage Drinking Committee that works on all of our strategies, focusing on reducing and preventing underage drinking. Our Prescription Drugs Committee, same thing, but focusing on that substance itself, prescription drugs. Our Interfaith Committee that focuses on building relationships with our faith based communities here in Essex County and increasing the resources and support of substance use prevention in the interfaith community. And then the LGBTQ plus committee that looks to do the same thing within our LGBTQ plus community here in Essex County. And we follow what's called the strategic prevention framework, which looks to begin by assessing. So we need to find out what the problem is before we do any work in the community. From there, we build the capacity, build the support. We start planning, implementing, and evaluating the work that we're doing. And throughout the entire process, we make sure that we stay sustainable and that we build cultural competence to make sure that we're effectively interacting with the diverse communities that we have here in Essex County. So that's just a quick synopsis of who we are, what we do. With that said, I'll stop sharing my screen real quick. All right. So once again, I'd like to introduce Kathleen Pete, one of the coordinators for Family Connections Outpatient Mental Health and Substance Abuse Services. Thank you very much once again, Kathleen, for being here with us and for discussing such a timely and important topic. We know over the past 10 months now, maybe, maybe a little, well, a little bit less than that, since March until even most recently last week. Tensions have been very high. People's stress levels have been very high. So this is a very timely discussion that we're having. So without further ado, Kathleen, I'll pass it on to you, and I'll ask you to share your screen so we can start the discussion.
Okay, thank you so much, Joel. Hi, everyone. I'm Kathleen Pete, LPC, and I'm a program coordinator at Family Connections. And, I'm just going to share my screen and we'll kind of take it from there as it'll kind of be a nice guide for me as we enter our discussion for today. So, I kind of wanted to start by talking about kind of Family Connections, our outpatient mental health and substance abuse services, and just to kind of give you a little uh, general general idea of what we provide and what it looks like. Our outpatient mental health services, we provide individual, couples, and family therapy for children, adolescents, and adults. We also have a outpatient substance abuse program that provides individual and group counseling services for adolescents as well as adults. At this point in time, it's great to know that we offer services via audio and video telehealth in order to help them meet the mental health needs of people seeking services within the community, especially since we're all kind of what I like to call hunkering down and staying safe, and kind of navigating the current circumstances that we're under. Um, and I'll definitely, as part of our presentation, I've infused kind of when it would be helpful to kind of seek mental health services towards the end, as a lot of the conversations and the questions that were provided will kind of build to that. But I do want to let you know that at any point in time, if you or a loved one is in need of support and counseling services, please feel free to give us a call at 973 675 3817. That's our main agency number. And then you just follow the dial in prompt for our mental health and outpatient substance abuse services. And once you hear that, you kind of press that, and then you will be directed to our front desk administration staff, and then they'll take your information and kind of guide you as to what the next steps would be to see what services would be most beneficial in receiving support. And, as we kind of talk about mental health, I do definitely want to provide some mental health statistics in general, because not only are we managing anxiety, stress, and COVID, and everything that's happening in the world at large, but it's also definitely tied into general mental health as well, but also as well as clinical mental health. At this point in time, in the United States, almost half of adults, 46.4%, will experience a mental illness during their lifetime. And that mental illness might be depression, anxiety, bipolar disorder, schizophrenia. Some mental illness might be more short-term and situational. Others might be more long-term chronic conditions. 5% of adults 18 or older experience a mental illness in any one year, equivalent to 43.8 million people. Of adults in the United States with any mental disorder in a 1 year period, 14.4% have one disorder, 5.8% have two disorders, and 6% have three or more. It's not uncommon that when someone is diagnosed with a mental health condition, that another underlying mental health condition will kind of be in there as well. It's kind of what we call comorbid conditions with any kind of medical condition. Half of all mental disorders typically begin by the age of 14 and three quarters by the age of 24. In the United States, Only 41% of people who have had a mental disorder in the past year received professional health care or other services. Now, just to point out to you, these mental health statistics are from a few years ago prior to the COVID pandemic and the other stressors that we're kind of experiencing culturally. Um, so, most likely, these statistics definitely have increased over time within the past year. So, a little bit about kind of mental health and COVID. At this point in time, we're definitely experiencing more stress, fear, anxiety, and uncertainty. Social distancing and disruptions to our daily routines definitely have contributed to this. Worrying about our health and finances, coping with job loss, grieving the loss of loved ones, and adjusting to changes in routine with work and school have definitely affected and impacted each of us. Um, we're not able to, if we're not able to kind of reach out to family members to provide support like we once were, if we're trying to keep ourselves safe and healthy and them safe and healthy, or we're not able to kind of grieve a loss in the typical helpful supportive way because we're trying to keep ourselves safe and healthy and others safe and healthy. And this has definitely resulted in us, beginning to experience or have an increase in anxiety, depression, substance use, and chronic health conditions. So some of us might not have experienced any of that, and because of this really challenging time, we're starting to experience some of those symptoms. But then also, it's important to keep in mind others have these underlying medical conditions, have been coping with it, and now it's exacerbated. Um, so before we kind of get into kind of the self-care piece, just to touch a little bit more what we're experiencing, at this point in time, we're all experiencing this kind of uneasiness, and it feels like really vague and kind of like uncertain and unknown, and just this like just not right feeling, right? Sometimes we're like not able to sleep, we're waking up in the middle of the night, we're kind of a little bit more irritable and snappy, snippish with others. Um, Sometimes we might be also like withdrawing a little bit and kind of becoming a little bit more inward. um, you know these are kind of normal reactions considering the circumstances we're under. So anytime, with disasters or public health emergencies, um, it leads to a lot of disruption and stress, and it has a lot of significant impact on how we manage and navigate our daily lives and our interactions with others. um, you know Part of that is, at this point in time, 1/3 of Americans have shared that they're feeling and showing signs of clinical anxiety or depression over the course of the last several months. It's really important to be able to kind of pay attention to how we're feeling, and incorporate self-care, as part of the process to help manage the stress, anxiety, and changes in mood that we're dealing with. Um, a lot of times, when we're feeling threatened or stressed or experiencing ongoing stressors, in ways that we didn't know or couldn't anticipate for, um, just a little bit of brain biology, our prefrontal cortex and the amygdala, our kind of fight, flight, or freeze part of the brain, um, start to kind of develop stress hormones. And that causes distress not only in the body, but also in our mind and in our thoughts. Um, Sometimes what we might start to experience is our heart beating faster, muscle tension, not being able to sleep as well, having a hard time concentrating and focusing on things like we kind of once did, kind of like that mental fog. But the way we all experience it varies, but that's kind of like the general sense that kind of happens. And when there's that shift in our kind of loss of our normal routines that we were once used to, it affects on how we're able to kind of regulate stress and our emotions. Um, so it increases that kind of, I guess, the fear and the stress, and it kind of, so to speak, trips that wire in our brain of the fight, flight, or freeze, which keeps us safe if we're actually in danger or in harm's way. Um, so, for some people, as they're experiencing, this, just what's happening in the world and what they're experiencing in their own lives, and then also kind of what, what their thoughts, feelings, emotions, and behaviors are, it might resolve on their own, right? But others might need to seek the support of a mental health professional, and or a counseling professional, and that can come in a lot of different forms. That could be a psychologist, that could be a psychiatrist, it could be a social worker, a licensed practicing counselor, a pastoral counselor, but someone that can kind of help you process and explore and understand what's happening and kind of develop some coping strategies and skills. um, with that being said, for some people, like I said, it resolves on their own, but for others, it's really helpful to kind of seek support. But before we kind of get into what that would look like for seeking support, like what those ongoing kind of thoughts, feelings, and emotions look like, sometimes what we can do is we can kind of learn to kind of practice some self care strategies. Um, and when we like learn to incorporate these self-care strategies, it can really help with managing our emotions. And when we're managing our emotions, it results in us being able to manage our thoughts and our behaviors and kind of respond to things as opposed to react to circumstances or situations. The first and foremost step is kind of acknowledging and experiencing all of your emotions, and especially in this time, the uncomfortable ones. You need to be able to kind of sit with and be with those feelings, whether you're feeling angry, irritable, anxious, distressed, lonely, and be okay, like be okay with that. Like it's not it's okay to not feel okay, and acknowledge that. Um and once you kind of acknowledge that, then kind of trying to implement some coping skills and coping strategies can help kind of lay the foundation that will make it easier to be able to work through stress, anxiety, changes in mood. So, some really helpful coping strategies at this point in time are definitely, um, you know, limiting our exposure to news. Obviously, sometimes people kind of, it's very easy to kind of get oversaturated and hooked on the headlines, but that can actually trigger stress and anxiety, and be very detrimental. So everyone kind of knows their threshold with that. I think everyone kind of has like an internal response to that, knowing when too much is too much. What I would like to say is really try to limit it. Put time frames around it. Whether you watch the news in the morning for an hour, or in the evening for an hour, or the afternoon, or a half hour, just to kind of know what's going on and kind of get a pulse of what's happening. That's great. For some people, it might be like they're just going to do a check in with the news a few times a week. Um, you know yourself. I always tell people, you know yourself quite well, and with these coping tools and strategies, you infuse what works for you, and then you can always modify it if you find it's not working, where you add a little more, or you scale back depending on what the coping strategy is. Um,
And
part
I'm
Yeah, go
sorry,
ahead. Sorry. No, no,
real
I'm
quick,
sorry.
Kathleen. I just want to add for our viewers and also for our coalition members that uh, just a little bit of behind the fourth wall. So Kathleen and I had discussions before, and a lot of your great questions were shown to Kathleen. So some of the discussions she's having now are based on your questions. So a little bit afterwards, I'll include those questions, or I'll let Kathleen uh, or not let I will advise Kathleen of those questions again and see if there's anything else that she would like to add. But going back, our members asked some very great questions, and a lot of them are being answered right now by Kathleen within the presentation itself, so that we make sure that whatever you asked, very meaningful, and you took the time out to ask them, they are being answered here, but within the presentation itself by Kathleen. So thank you very much for including within your presentation the questions that were asked by our coalition members.
Thanks. And what I'll probably do is maybe I'll just touch on, maybe what sections these questions kind of touch on. And then if there's anything we need to elaborate on, we definitely will. You know, how to take care of ourselves and our loved ones really touches on the question of if we're experiencing anything kind of traumatic or fearful and how it's affecting you and the impact you think how your feeling might have on someone else, whether it's another adult in the household or children in the household. And then also these next couple of slides definitely touches on what you can do to kind of support your own mental health and the mental health in your children. So a lot of it is sometimes in those environments, what others see us do, they learn, and they learn the coping strategies indirectly. And then you can definitely modify these to meet any age range with whatever they might be kind of dealing with at that point in time. So I guess continuing on with that, like limiting the exposure to the news. If you're limiting your exposure to the news, most likely then your family members aren't seeing as much news, so it's really helping them to kind of not get over have that overexposure and that kind of increased stress with trying to make sense of everything that everyone else in the world is trying to make sense of in real time. um, you know, Practicing meditation and mindfulness, and it doesn't have to be really big or elaborate. It can be just like a simple 3 to 5 minute meditation, 10-minute meditation, half hour, whatever works for you. Um, when we kind of engage in meditation or mindfulness, it 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 reduces the cortisol, which is a stress hormone, which is released when we're feeling stress, is the stress hormone. And that stress hormone also, once again, kind of sharing a little bit of biology. There's a lot of biology that goes with this, and I find when people kind of understand that, they're like, "Oh, I had no idea. Like my body's doing this, and this is kind of contributing to it." So there are things I can do to kind of reset my body to then kind of manage the stress and the anxiety and changes in mood. Um, so when that stress hormone is released, that cortisol, that kind of trips off that fight, flight, or freeze part of the brain. It's like the chemicals in the brain all of a sudden say, stop thinking with your kind of prefrontal cortex, the rational piece that we know we're okay. Yes, this is a difficult time. We can find ways to kind of get through this. There's solutions, there's problem solving. It goes to that other part of the brain where it's like, I'm in danger, things are happening. I either gotta get ready, geared up to kind of take it on, or I got to kind of shrink and stay safe and stay still, or I got to kind of get the heck out of here. So that's where sometimes that uneasiness, kind of that feeling that we're experiencing happens. When we engage in those mindful activities, whether it's kind of taking deep breathing or just kind of distracting ourselves in a helpful way, it allows us to kind of not only quiet our minds, but as we start to reset our body, and then the chemicals in our body then kind of, I guess, in a really cool way, let our brain know, hey, things are okay. Um, like the example I kind of like to use is we're all sitting here, and as we're talking and listening and taking notes and thinking of questions, our heart is pumping blood through our veins, our kidneys are working, our white blood cells are fighting off any germs. But we don't feel that happening, but it's happening because that's just kind of how our body works. So there's a part of where our body's working, but then there's parts of where we can kind of consciously incorporate things to help our body work more efficiently and effectively, and manage our mental health wellness and our mental health in general. Um, Exercise is fantastic. Engaging in any exercise or physical activity, it could be anything. I know a lot of people are doing like walking, running, um, whatever it might be for you. And I know at this point in time, things are a little bit like limited, but doing something is always doing better than doing nothing. Um, the quantity isn't as important as the quality of it, and getting into the routine of doing it. And what is really helpful is, because we've lost routines in a lot of ways, it's helpful to kind of create new routines, because creating new routines just like helps us feel more in control. When we feel more in control, we feel less stressed, and when we feel less stressed, our body's not releasing as much cortisol or stress hormones. It's releasing the feel good hormones, which help with inflammation, and also help with stress management. um, journaling for some people, just kind of writing their thoughts down in a free form of what it was like, just to have a place and space to kind of compartmentalize so they can kind of reset and move along is really helpful. um, and it's a great way to kind of find a place where it's very quiet, no distractions, and you just kind of have that moment to kind of focus on you and kind of what's going on. Connecting with others, finding ways to be social. I know we can't be social in the way that we once were, but using Zoom, using social media, calling someone on the phone is really helpful. Or, depending on your comfort level, if you're okay getting together with people where you're socially distanced and you're kind of, wearing your mask, um, it's helpful just to kind of sometimes see people in 3D, that's a feel good thing. Um, doing activities that you enjoy, any hobbies or, hobbies, activities, is nice because it allows you to kind of ground yourself and kind of it provides an escape from, the everyday stuff that we're faced with. And just having that break can really help us reset and re energize to be able to kind of tackle our day for that day, tackle some challenging obstacles or barriers, and not only be there for ourselves, but to be there for others. Um, Most importantly, getting plenty of rest. Sticking to a sleep schedule and sleep routine not only kind of resets your body's internal clock, but it also helps with falling and staying asleep. Um, and once again, this is also creating a routine. And with any routine, there's a sense of predictability. And like have that sense of predictability, it makes us feel more in control. And when we feel more in control, we feel more relaxed. And once again, there's that mind body connection to kind of creating new routines and consistent routines. So we did touch on a little bit of self-care and kind of being like, well, what can I do as part of self-care? And what does self-care look like? Because a lot of times people think it has to look like this really kind of thing that's more financially invested, like a spa day or going on this like extravagant trip. Um, that's not true. Self-care is any activity that we do deliberately in order to take care of our mental, emotional, and physical health. Good self care improves mood, it decreases anxiety, helps create balance to tackle daily challenges, and makes us better equipped to respond to various demands and transitions in our lives. It's something that refuels us and allows us to take, once again, I can't stress it enough as I wrote it twice, to take better care of ourselves, of others and ourselves. And it's a habit, and it's a habit that is important to have as part of your daily, weekly routine. It could be something that you do every single day, 7 days a week, or it could be something that you incorporate a couple times throughout the week or as needed. And you can always bump it up or bump it down depending what your day or what your week might look like. I always encourage people, what? Carve out 30 minutes each day or a few days a week, whatever that looks like for you. Um, and be curious. Be curious that when you start to carve that time out, what what the outcome is, because people will sometimes say, hey, I don't have before I get into self-care habit ideas, I don't have 30 minutes, I'm so busy, I'm stretched so thin between like work, school, household responsibilities, family care responsibilities, whatever that might be. um, Ask yourself this, and I know I've been guilty of it: how much time are you spending on social media or television, right? On average, I think, I don't know like the exact stat, but every time I hear it, I'm like astounded and I'm like, no way. And then when I self reflect, I'm like, yeah, I can see where, yeah, Yahweh. On average, I think most people on social media and like television and stuff spend about like a good 5 hours each day, if not more, or if not less. And the less really looks like maybe like 2 or 3 hours. But still, those are big chunks of time. So maybe then to kind of develop the habit to say is, all right, I'm going to watch TV or whatever, social media or whatever it might be, a half hour less each day or a couple of days a week. And then in its place, I'm going to substitute one of the following self care activities that I'm going to share with you. Um, you know, and it's also not only just, it's self-care, but it's also things that we can do, especially and getting creative things with things that we can do and finding different things that we can do because of, the pandemic and having to hunker down and having limitations with being able to go and do things as we once were able to do so freely. So here are some things that touch on the question that someone asked for, any suggestions for free or cheap things that I can do to take care of myself. So one of the things is reading. And when I just say not just reading a book in a general sense, is like find a read and share. You could either pick out a book, sit and read with family members, sit and read to another family member, or have other family members read to you. And you kind of do like a little bit of story time. Think about rereading an old favorite book. I think everyone has a book that stands out to them, at any point in time. Try to get a hold of that book and pick it up and reread it, because every time, people that enjoy reading always find something new in books that they've always enjoyed. Um, or pick a series to read. You know how many times people say, "Oh, I would sit down and read that series before everything kind of was more limited as it is now." This is the perfect time. I like the series that comes in mind to me that I was like, hey, maybe I might consider rereading that is, Harry Potter. Like, there's so many books for that, whatever it might be for you. Um, and like I said, reading to others, if you're reading to your children, if your children are reading to you, or if you're reading to an elder family member, you know, it's connecting. We're doing something. We're kind of escaping from everything that we're kind of inundated with, and it's giving time for ourselves, and it's giving quality time to others. Um, Writing cards or letters. I know you could be pen pals with people. You could surprise friends or families with like a little thank you note or a little surprise card, and write something very sentimental, like what you appreciate about them. Not only that process is it helpful for the person sending, but you'll find that the person receiving it really is grateful for it, and it can, it's this two-way street of how it can be really beneficial and really supportive. um, if you don't want to send cards to friends or family members, you can think about sending cards to military service members or to people who are in nursing homes. And that's kind of like a volunteer kind of act of kindness. A lot of times that, when we are servicing others, there's a lot of gratitude that we kind of experience with that. And that's a great way of kind of like a self-care habit or an activity to kind of be able to do. Um, Documenting life stories. So this is a perfect time when, we're around others to maybe see, kind of get our family history. And part of that process, there's an app called StoryCorps app. And it's like a do it yourself self guidance of like walking you through like how to like record life stories and family history. um, there's also a thing called Legacy Project, and it gives you a list of life interview questions to kind of like ask of yourself and ask of others. It's really, from what I've seen and read, it's really neat, and people kind of, you'll be surprised to see what you learn not only about yourself but about family, friends, or whoever else is kind of, part of your family. I always like to say, like, there's our family that we're kind of born into, our biological family, but then there's our soul family of people we kind of pick up along the way that kind of come into our lives. And whatever that looks like for you, be creative, and incorporate whoever you want to be able to kind of incorporate into this project. And it sometimes results in hearing a lot of stories and reliving a lot of stories, and there's a lot of comfort in that. um, just kind of puzzles and board games, having sit down and having a game night, carve out some time. Okay, like Tuesdays and Thursdays we sit down and when we do a game night, and everyone just kind of puts their cell phones away, gets rid of the technology, whatever. Each person can pick a different thing to do each week. If you don't have access, to kind of board games or puzzles, you can kind of do win, lose, or draw on your set on your own, like at a little piece of paper. Or you can do, what's the other one? Charades. Or like another cool one is everyone like writes down like a historical figure or a notable figure, and then you kind of tape it to your head a little bit, but and then the other person, you have to ask like they have to ask you questions to kind of guess, and you have to kind of guess the person that's like stuck to your head. Um, it's fun. Um, Listening to podcasts or watching movies and TV shows, a lot of information out there. There's so much kind of really cool podcasts to kind of be able to hear and listen about and kind of learn and explore. This one was really neat, having an online adventure, so virtual tours. So a lot of the world museums, not only in the United States but across the world, are offering free online virtual tours of the museums. So, for example, the Louvre in Paris, the Met Museum in New York, the Vatican Museum, the British Museum of Modern Art. I mean, that's just like four that I've listed, but there's a bunch. Even in Los Angeles, all the big notable museums, just kind of Google online virtual museum tours, and all these things will pop up. And it's a nice way to kind of be able to kind of explore and still stay in touch with something that maybe you're not able to kind of connect to at this time in the way that you once were. But it's creating a new routine and giving yourself that booster. Listening to music and dancing, just throwing an impromptu dance party. Or I think this is really cool. Everyone kind of, depending, how old you are, or I don't know, how young you are, there is that period of time, I like to say, that high school range time, where I find everyone really kind of has a lot of nostalgia with the music that they listen to. If you're able to kind of get an album of your favorite artist at that time and really listen to it, like just put on a good pair of headphones, or turn the volume up and sit and just listen to that through and through. It's like you kind of are hit with that wave of nostalgia and kind of like that feel good moment. Or finding a current album, or doing like a kind of like a music exchange with whoever you're living with, or if they're virtual or they're not living with you, kind of saying like, hey, I want you to listen to this album, this is someone that I really like, listen to the album. And then they say, you listen to the album, and then you kind of compare and exchange notes and kind of be your own like music critic. You'd be surprised, in that kind of exchange you might learn something new. You might be exposed to a type of music that you never probably would have prior to. And then this one's been pretty popular for people, is just kind of starting and creating your own do-it-yourself project. Um, you know, People are like, oh gosh, clearing that clutter drawer. I've never had time for it. Or kind of organizing the closet, or cleaning out the garage, or painting something. Some of it might be a creative thing. It might be like, okay, I'm just gonna learn how to do origami, or I'm gonna learn how to do. Everyone has paper at home, and you can always YouTube it, and you can kind of cut the paper as it needs to be, and then you kind of fold it. Or drawing or painting, or like anything. The sky's the limit. Like if it's something that's kind of in your mind, be curious about it and give yourself the opportunity to explore it. What's the worst that can happen? You do it and you say, didn't really like it. Or it might be like, wow, I actually like this. And more often than not, it leans towards where people kind of enjoy it, and it might become something new. um, and then sometimes also too, just to kind of, sometimes just keeping it simple, like just back to basics, where it's just like everyone's just around each other. If you're living with someone, or with your family, and everyone's kind of just doing their own thing and just kind of being in the space amongst each other. Sometimes that's nice too, like to say, because before we were, so everyone had so much more going on with their with their routines and other obligations, that it's like, oh, I never get to see anyone. And then now, like, we're seeing everyone a lot, like if we're living with them. So it's just sometimes maybe just, reframing that mindset to be like, you know what? We're around each other, and I'm just going to enjoy their company. So it's just finding that balance and kind of what works for you. Um, so, what I want to kind of share with, after talking a little bit about mental health statistics, and talking about self care strategies and coping strategies, um, you know, when should you or a loved one, seek support? So, what I would say is if coping and self care strategies aren't helping, and you know whether it's you or someone else is experiencing stress, anxiety, or changes in mood that seem more unmanageable on an ongoing basis, like it's not necessarily just having like one bad day, but it's like a couple of bad days in a row, and it's happening through weeks on out. Um, and more importantly, it's where the stress, anxiety, or the changes in mood are getting in the way of your daily routines, whatever that looks like for you. It could be work, it's getting in the way of work or school or hobbies and activities, and even attending to personal care habits, and also how you're interacting with others, where maybe you're recognizing in yourself like that's not how I usually respond to being around others, or others are pointing out to me like there may be like, is everything, they might ask, is everything okay, you seem different, you seem off. Or the opposite might even happen, where people will start staying away, saying like, I can't be around you anymore, like you're, you seem angry and irritable all the time, and it's like I want to be around you but it's hard to be around you. It's someone kind of in their own way mirroring for you something that maybe, hey, is this something that you just need to be more aware of and kind of reset on your own? Or if you're aware of it and you can't reset on your own, it might be helpful to kind of be able to talk to someone. um, and I kind of want to share like what the anxiety, stress, or changes in mood look like. And it's really important to kind of know that more often than not, people are experiencing two of those bullet pointed kind of categories. So for the anxiety, stress, you might feel physical symptoms like ongoing muscle tension, aches and pains that are unexplained, not when you kind of bump your head into the kitchen cabinet, but just like kind of like stiff back, stiff neck, like like stomach is being off, and there's no explanation for it. Um, Cognitively, like with what you're thinking, with anxiety and stress, you'll have constant worries and you'll have constant negative thoughts. And no matter how much you might try to kind of like ignore it, it's hard to ignore, and it kind of distracts you from your day, and from focusing. Or you're reaching out to friends or family a lot, and you're kind of talking about the same thing over and over, and like no amount of reassurance or like problem solving is kind of like helping, and you kind of realize you're kind of stuck with it. Or the family member might be recognizing like that you're kind of stuck with it, and sometimes it kind of comes with the reaction of like, you keep asking this over and over again, I don't know what else to tell you. That's usually an indicator that we're maybe having a hard time managing stress, or we might be experiencing some anxiety, that talking to someone might be helpful to kind of know, is this situational anxiety and stress, and do we learn some coping strategies, or is this more of like ongoing clinical anxiety and stress, and then understanding that and then kind of learning some coping strategies with it. And the emotions that go along with it, it's like we're always feeling nervous, we're always feeling overwhelmed, we're always feeling panicky, this like pervasive sense of uneasiness. And these categories can go, for some people it could be like the physical, the emotion, or the physical and the cognitive, or the cognitive and the emotion. But you're experiencing that on an ongoing basis, and like I said, it's starting to affect with how you're relating to others, how you're accomplishing tasks, how you're performing at work, how you're performing at school. um, Sometimes we might start to withdraw a little bit, or we might kind of you know kind of avoid things that we used to kind of like to do. Mood changes. The changes in mood physically would be like you're feeling low energy all the time. Changes in appetite. You might be overeating and gaining weight, or you might be under eating and maybe not eating meals like you once used to. So, for example, if you're someone that kind of eats 3 meals a day, and then you're kind of maybe eating half as much did during those meals, or maybe skipping some meals on an ongoing basis, like that's an indicator that something might be off. Once again, with mood changes, we can also experience aches and pains and muscle tension that are unexplained. um, Cognitively, with our thoughts, we might have ongoing negative thoughts and difficulty concentrating, and difficulty focusing. The emotions that we start to experience is like ongoing sadness, a lack of interest in things that we maybe once did. Maybe if we might not be calling our friends as much, we might be withdrawing more. Maybe some of the self-care activities or coping strategies or other things other routines that we were able to maintain during this time, we're just not like, people are just like, I don't feel like it's really hard. I'm just feeling really unmotivated. I'm feeling really stuck. And also kind of experiencing some anger or irritability. Whether you just internally feel that anger or irritability, or it's coming out towards others. Um, More than just kind of having a bad day. Um, so like I said, you know, that's what it can look like, and that's when it can be helpful to reach out to a professional. And also too, it can be, talk you can always talk to your primary care physician about this as a first step, or your child and adolescent's pediatrician, to kind of get a sense of, hey, this is kind of what's been going on. What are your thoughts? And they can kind of then give you guidance as to what the next steps might be. Or if you can also just reach out to a counseling agency such as Family Connections, or another community-based counseling agency, depending kind of where you live, and kind of check in with them. And all it would look like is sometimes, just have a consultation, and to see, okay, this, have the professional say, what you're experiencing is definitely, normal. Everyone's kind of going through this. Let's keep our eye on this. Let's check in again, and let's see what it looks like. Let's talk about some coping tools and strategies. And it might be, there's no kind of time frame for it. It's kind of you um, checking in, seeing what's going on, and then kind of taking it from there with the professional that you're kind of engaging with, and kind of following their lead and their guidance. Um, so hopefully, this was helpful. I always like to end with, be kind, be safe, and be well. And when I say be kind to yourself, be patient with yourself, be patient with others. um, you know we're going to have more obstacles and challenges. One of the things that kind of is helpful to know, that I think everyone kind of has this, like, their own kind of mindset of like perfectionism, and kind of like what they wanted their routine to look like. In a lot of ways, we kind of have to let go of that, and be kind to ourselves, because perfectionism and pandemic does not mix. And if you try to force it, the universe will kind of send it right back to you. So all you can do is you just do your best. And as you're kind of being kind to yourself and doing your best, and kind of, you know handling things as best as you can, that's reflected to the loved ones that you're living with, and it's showing them how to kind of be adaptable, how to be resilient, how to manage challenges. um, a metaphor that I like to kind of leave everyone with is, listen, we never know what's around the corner. We like to believe we know, but we truly don't know, because that's just us being humans, of like wanting that, have like, to know what the future brings. um, we never know what's going around the corner. So look at life kind of riding a mountain bike. And then all of a sudden you turn the corner, and it's this huge kind of uphill thing. You just shift gears, and you pedal a little harder, pedal a little slower, and it's going to take you a little longer. And then you turn the other corner, and it's like, whoa, a steep decrease. You're going downhill, and like, okay, now you don't have to pedal as much. You just kind of coast and let the wind go through your hair, and maybe pump the brakes a little bit if it's going a little too fast. Or then you turn another corner, and the terrain is all bumpy, and you just hold on, and you go a little faster, a little slower. But the whole piece of the metaphor is, you shift gears, and it's all about learning how to shift your gears at this point in time, and at other points in time in your life. And as you're shifting gears, you're learning you can handle that uphill climb, that steep climb. You can handle that really steep downhill, like speed demon, like, going down the hill. You can handle the bumpy terrain. um, you're becoming a more skilled, like, bike rider of life, so to speak. So hopefully, hold on to that when you're kind of like, okay, everyone, we're pedaling harder, shifting the gear. So hopefully you can kind of embrace that, and kind of use that as something to kind of help you navigate with what we're all experiencing and what we're all going through. And like I said, if at any point in time, always, get the opinion of a professional, whether you start with your primary care physician or your pediatrician, or if you just start right at the door with a mental health professional.
Well, Kathleen, I want to say thank you very much. This was a extremely informative and amazing presentation that you've put together, and a very timely discussion that a lot of individuals need in this point in time. So I just want to say thank you so much for that. Uh, just as a quick plug, you've answered all of the questions that were asked, but I'll just bring it up real quick, just in case there's any other additional things that needs to be added, but I don't think there are. But just out of respect for the coalition members, just want them to know you had already mentioned a couple of the questions. So one being about there being trauma and fear affecting an individual, and it having an impact on their children, and what can they do to improve their mental health and support better mental health in their children. You provided some great insight on that. There was another question regarding looking at suggestions for free or cheap things that you can do to take care of your self-care, and you provided a lot of amazing examples that people can use that are free.
And
And
I will be using two because it's highlighted for me. I'm like, oh, I can do something.
exactly. And along those lines, there were people who were saying that they usually just hear about meditation and breathing exercises,
I get
and
it.
they wanted to see if there was anything else. And you provided a robust amount of examples of other things along with meditation and breathing exercises, which are important. But you provided a plethora of examples of free, affordable resources and information that people can use. There were people who were asking about the phone usage and challenges
Yeah.
regarding
I
that.
don't think I got to that one.
So yeah, if you have any other recommendations on ways to help teens and young adults reduce their time on devices, you mentioned
Absolutely.
some
Yeah.
challenges around that, but if you have
Slightly.
any
Yeah.
recommendations.
So with this is, it's all about developing habits, right? Excessive phone use is become a bad habit. So what it looks like is, taking small incremental steps to kind of reduce time on the devices. And sometimes that can look like where the whole household kind of has a phone timeout. So for example, it could be like, after virtual school, okay, no cell phone for an hour, or at the dinner table everyone puts their devices away and we're just sitting there, either asking and checking in with each other about our day, or just sitting and enjoying your meal, right? That's being mindful when you can sit there and kind of enjoy your meal and kind of be like, oh, I really like this. And that also kind of covers that part of like just being around each other. Like sometimes you don't have to talk, sometimes just the energy of being around each other and being present is very comforting and soothing. Um, you know, it could
I've
also,
got one tip along those lines.
yeah,
Just we haven't done it in a couple of weeks, but we usually do at the end of the day story time. So a half hour or so, just everybody picks up a book and reads just
yeah,
before bed to make sure that they disconnect from any devices that they have due to
yeah.
all of
I
this
love that you
virtual
bring that
environment.
up because a big piece of it is too sometimes it's not enough for some people just to kind of put it away and not have access to it. It's like then substituting it with one of those self-care strategies or those hobbies or activities that we talked about. Whereas like, you know, Joel kind of shared is like, okay, we're all going to read. It doesn't matter what you read, but you're just going to read something. And whether you read to each other or you read on your own, that's totally fine. And then just being curious about it, like incorporating that habit, whether it's say, okay, I'm going to start with 15 minutes or 30 minutes, and then checking in with yourself. Well, what was that like? Was it like really awful, or what? Like, was it pretty okay? And is it something you would kind of do again? And then you kind of add more to it, because the great thing about it is when you start to realize that there is a payoff to it and it kind of creates more balance and less stress, you're going to do it more often. And there's been a lot of things on television that kind of talked about that, where the family kind of together as a whole, or the person on their own implemented that habit. And at first it's a little hard, it's a little kind of, uncomfortable, but then as they kind of stuck to the consistency is the key, they stuck to the consistency with it and they made it like manageable consistency. they the end result for everyone was like, I feel less stress, I feel more connected with others, I'm learning something new and cool. So in and of itself, just kind of getting into that habit is like really helpful. um And I guess too, just to kind of add for other like free things, there is what is it called? New Jersey Fun, or Fun Things to Do in New Jersey. And it's like the kind of like the county website. And then they'll have things listed. Some of them might have like a small monetary thing, but you can always look into it to see if you can swing it financially. But not only that, they have things that'll say it's free. So that's like another helpful like resource. Also, your like local park and recreation, maybe calling them to see what they offer, or what they have on their website, because I think now a lot of towns have kind of put different things up for people to kind of be able to do and connect with. And also, to your local public library might be doing a lot of things online, like book clubs or presentations of like local speakers or presenters that you can kind of maybe be able to catch online. So you're still kind of sticking to that routine. So definitely look into that. And like, just to kind of recap, when we're kind of experiencing changes in our mood, or we're kind of experiencing, feeling kind of traumatized with kind of what's been going on and what's been happening. It is, this a pandemic is a form of trauma. Losing a job is a form of trauma. Um, Losing a loved one, those are all traumatic experiences. um, when we take care of ourselves, then we're able to take care of others. And I like to always use the airplane kind of metaphor, like when the flight attendants say, okay, if we need oxygen and that thing drops, put the mask on yourself first before you put the mask on anyone else. And the reason being is, if you're fiddling around try to help everyone else, eventually you're going to start to kind of feel dizzy and loopy, and you're going to pass out. And then if you're passed out, the people that you want to help are going to end up passing out too. So then no one's being helped. So if you put that mask on yourself, then you can tackle every single challenge or every single task that's kind of coming along your way. And you can do it in a way that um, works for you. So always put that oxygen mask on yourself first before others. And let's use that kind of metaphor as well. Um, because you'll have the stamina then to help everyone out, including yourself.
Exactly. I think that's perfect. And I think that's a perfect way to end our discussion today. I think it was an amazing presentation. You provided some great details and insight into the challenges that we're dealing with, but also more importantly, what we can do to manage things now. So I want to say thank you so much once again, Kathleen Pete, coordinator for Family Connections, Outpatient Mental Health and Substance Abuse Services. Truly insightful presentation here today. I think we received a lot of insight and information that our coalition and our public here in Essex County can utilize. Uh, Thank you for everyone who was taking part in the original watch party for this, but also this video will be live on our YouTube page. If there are any questions from anyone during this watch party, we'll make sure to get it over to Kathleen, and she'll make sure to answer questions for our members. We ask folks who would like to stay involved, always check out our YouTube page for more of the videos, more information, and more insight. And you can also visit our website, www.essexadapt.org, and Family Connections at www.familyconnectionsnj.org. So, Kathleen, thank you so much. Truly appreciated this presentation you had with us today.
And thank you so much for having me as your guest speaker. And thank you for everyone for the really thoughtful questions and important questions that you asked, because this is something that everyone thinks about all the time.
Mhm.
And I really appreciated that feedback, because it really helped me kind of guide as to what's going to be the most helpful thing for everyone out there. And like Joel said, if there's anything that kind of starts kind of percolating, that like, oh, I want to ask about this, or I wish I would have asked this, feel free to ask it. And we'll post something to kind of touch on that as well. But hopefully you guys got a nice little continuum, a broad kind of sense of what stress, anxiety, mental health wellness, during COVID, and the other cultural and worldwide challenges that we're experiencing. So thank you so much. And it's been an honor.